Welcome back. Let's talk for a few minutes about privacy protection for telemental health visits. This has been a real thing since 2020 and COVID-19 started. More mental health practitioners were moving to telemental health for providing services during the pandemic. And telehealth is a really safe and secure way for the healthcare provider to connect with their patient online. And just like in-person care, your telehealth appointments, your messages, and information are protected by the privacy rules. And telehealth connects patients with healthcare online using a computer, a tablet, or a smartphone. And although your appointment will use your regular internet service or data plan, we as healthcare providers are typically using secure patient portals to message or call or video chat with patients. And during the COVID-19 public health emergency, there were some federal policy changes that have allowed healthcare providers to sometimes use popular video chat programs for telehealth care. And HIPAA, the Health Insurance Portability and Accountability Act of 1996, ensures that healthcare providers protect patients' personal health information. And all of the telehealth services that you provide need to be in compliance with those HIPAA rules. Covered healthcare providers must use technology vendors that are HIPAA compliant, and they need to enter into a HIPAA business associate agreement in connection with the provision of those video communication products. The Department of Health and Human Services Office for the Civil Rights has issued a notice regarding the expiration of enforcement discretion for HIPAA flexibilities. Those HIPAA flexibilities will be discontinued on May 11th in 2023. Well, they were discontinued on May 11th in 2023 when the COVID-19 public health emergency ended. And those covered healthcare providers we're in this 90-day transition period after that date to comply in good faith with those HIPAA rules without any penalties. And we have until August 9th of 2023 in order to comply with the HIPAA rules that were there previously. So what that means is that covered healthcare providers and health plans or covered entities can use remote communication technologies to provide audio-only telehealth services when such communications are conducted in a manner that's consistent with the applicable requirements of HIPAA. The privacy, the security, and the breach notification rules, which I'll refer to as the HIPAA rules, which you can find in a previous lesson that you've already done. The U.S. Department of Health and Human Services, the Office for Civil Rights, developed this guidance to kind of help these covered entities understand how they can use remote communication technologies for audio-only health in compliance with the HIPAA rules, including when the OCR's notification of enforcement discretion for telehealth remote communications is no longer in effect. So basically, the video chatting with our clients has come to an end, and we can use audio as far as our telehealth services are concerned. So let's talk a little bit about some of these frequently asked questions, and hopefully I can provide some guidance to assist you guys if you're a covered entity in complying with the HIPAA rules when OCR's telehealth notification is no longer in effect. So the first question is, does the HIPAA privacy rule permit covered healthcare providers and health plans to use remote communication technologies to provide audio-only health services? Well, the answer is yes. HIPAA-covered entities can use remote communication technologies to provide telehealth services, including audio-only services, in compliance with that HIPAA privacy rule. And the HIPAA privacy rule requires that covered entities apply reasonable safeguards to protect the privacy of PHI from impermissible uses or disclosures, including when they're providing telehealth services. So, for example, the OCR expects the covered healthcare providers to provide telehealth services in private settings to the extent feasible. If telehealth services cannot be provided in a private setting, like where a provider shares an office with a colleague or a family member, then the covered healthcare providers still must implement reasonable safeguards, like using lowered voices or not using speakerphone to limit any incidental uses of disclosure of the PHI. In addition, if the individual is not known to the covered entity, the entity must verify the identity of the individual either orally or in writing, which could include using electronic methods. The HIPAA rules don't mandate a specific way to verify identity, but covered entities should be mindful that civil rights laws generally require communications with an individual with a disability to be as effective as communications with others, including by providing appropriate auxiliary aids and services where necessary. And this requirement extends to all communications with an individual with a disability, including communications related to verifying the individual's identity. And in addition to this, when necessary, these covered entities must verify the individual's identity by using language assistance services to really provide meaningful access for individuals with limited English proficiency. The next question is, do covered healthcare providers and health plans have to meet the requirement of the HIPAA security rule in order to use remote communication technologies to provide audio-only telehealth services? Yes, in certain circumstances. So the HIPAA security rule applies to electronic protected health information, which is PHI that's transmitted by or maintained in any electronic media. And the HIPAA security rule does not apply to audio-only telehealth services that are provided by the covered entity that's using a standard telephone line. And that's often described as a traditional landline because the information transmitted is not electronic. Accordingly, a covered entity does not need to apply the security rule safeguards to telehealth services that they provide using the traditional landlines, regardless of the type of telephone technology that the client is using. However, these traditional landlines are rapidly being replaced with electronic communication technologies like voice over internet protocol, or what we call VoIP, and mobile technologies that use electronic media like the internet, intranet, extranets, cellular, Wi-Fi, things like that. So the HIPAA security rule applies when a covered entity uses one of these electronic communication technologies. Covered entities using telephone systems that transmit ePHI need to apply the HIPAA security rule safeguards to those technologies. And we need to note that an individual who's receiving telehealth services may use any telephone system that they choose, and they're not bound to those HIPAA rules when doing it. So a covered entity is not responsible for the privacy or security of the individual's health information once it's been received by the individual's phone or the other device. Then it falls into their hands to protect their information. For some, well, let's go back. So for example, some current electronic technologies that covered entities use for remote communications that require compliance with the security rule, they might include communication applications like apps on a smartphone or another computing device, the VoIP technologies, technologies that are electronically able to record or transcribe a telehealth session, messaging services that electronically store audio messages. Some of the potential risks and vulnerabilities to the confidentiality or the integrity or the availability of the electronic PHI when using these technologies need to be identified, assessed, and addressed as part of the covered entity's risk analysis and their risk management process. And that needs to be as required by the HIPAA security rule. And a covered entity's risk analysis and risk management needs to include a few considerations, like if there's a risk the transmission could be intercepted by an unauthorized third party, or the remote communication technology like the mobile device or the app, does it support encrypted transmissions? Is there a risk that the electronic PHI that was created or stored as a result of the telehealth session, like your session recordings or your transcripts, could they easily be accessed by an unauthorized third party, or whether encryption is available to secure those recordings or transcripts that were created or stored by that telehealth session? Is authentication required to access the device or app where the telehealth session electronic PHI might be stored? Does the device or app automatically terminate the session or lock after a period of inactivity? As communication technologies like networks, devices, and apps continue to evolve at rapid pace, a really robust inventory and asset management process can help covered entities identify these technologies and the information systems that use them to help ensure an accurate and thorough risk analysis. You guys can get more information about this on the HIPAA security rule requirements by looking at the OCR security rule guidance webpage. The next question is, do the HIPAA rules permit a covered healthcare provider or health plan to conduct audio-only telehealth using remote communication technologies without a business associate agreement in place with the vendor? The answer to this is yes, in some circumstances. So the HIPAA rules require a covered entity to enter into a business associate agreement with a telecommunications service provider, or a TSP, only when the vendor is acting as a business associate. So a covered entity using a telephone to communicate with patients is not required to enter into a BAA with a TSP that has only transient access to the PHI that it transmits. But the vendor is acting merely as a conduit for the PHI. If the TSP is not also creating, receiving, or maintaining the PHI on the behalf of the covered entity, and the TSP does not require access on a routine basis to the PHI it transmits in the call, no business associate relationship has been created. Therefore, a BAA is not needed. So, for example, a covered healthcare provider may conduct an audio-only telehealth session with a patient using a smartphone without a BAA between the covered healthcare provider and the TSP, where the TSP does not create or receive or maintain any of that information from the session, and it's only conducting the call. However, a covered entity must enter into a BAA with a vendor that's more than just a mere conduit for the PHI. So, for example, a covered healthcare provider may want to conduct an audio-only telehealth session with a patient using a smartphone app that's offered by a healthcare provider that stores the PHI, like recordings or transcripts, in the app, like in the developer's cloud infrastructure for the provider to later use. And in that case, the app would not be providing mere data transmission services and would instead also be creating and receiving and maintaining the PHI. And because it's not merely a conduit for transmission of the PHI, the provider would need to enter into a BAA with the app developer before it can use the app with patients. Similarly, a covered healthcare provider would need a BAA with the developer of the smartphone app that the provider uses to translate oral communications to another language to provide meaningful access to individuals with limited English proficiency, because the app is creating and receiving PHI, and therefore the developer is a business associate of that provider. And the last question here is, do the HIPAA rules allow covered healthcare providers to use remote communication technologies to provide audio-only telehealth if an individual's health plan does not provide coverage or payment for those services? Yes. Covered healthcare providers may offer audio telehealth services using that remote communication technology that's consistent with the requirements of the HIPAA rules, regardless of whether any health plan covers it or pays for those services. Health plan coverage and payment policies for healthcare services that are delivered via telehealth are separate from questions about compliance with the HIPAA rules, and we're not really going to address that here, but I mean, you could charge your client cash pay and let them pay cash for the services if that's what they're choosing. All right, so let's talk about privacy during your appointment. You're going to make sure that you're calling your client from a private setting like your office or an appointment room. And the client should also be in a private, safe location where they feel safe to openly discuss their health. And these private locations for your client for the appointment could maybe be a private room in their house, or maybe their car, or a private room in a friend's home, or outdoors away from other people. If they can't find a private place for video telehealth appointments, they have to let you know. You may be able to email them or chat or text through your, text your client through that patient portal instead. And you can also help your client to reschedule or suggest a location for the visit. We want to make sure that they're not driving down the road because it is illegal to have a phone in your hand in the state of Georgia. And we know that telehealth makes it possible to get some healthcare services wherever you are. So keeping telehealth private and secure is the responsibility of the patient and the provider. And our clients can take some steps to kind of protect themselves when they begin conducting or connecting with their providers online. And for clinicians, it's really important for us to follow some standard rules, but we also need to inform our clients of these rules too, like only entering your personal information on secure websites with the lock icon in the address bar. We want to make sure it says HTTPS, not just HTTP. If there's not the S stands for secured. So we want to make sure that it is a secured website. We want to keep our devices protected with updated antivirus and anti-malware software. We want to protect our wireless connections with a password. We want to avoid using public Wi-Fi to access telehealth services. And we also want to avoid accessing telehealth on devices that are shared with people outside of your home or your family. And for clinicians, we don't want anybody having access to it, not even our family. And we want to make sure that we're not setting up a telehealth appointment or sharing our information with, anybody that we don't know, especially clients. We don't want them linking up with a provider they don't know or maybe information that they don't recognize. So we can tell them to call our main phone number to confirm our identity first when situations like that come up. And I know I'm harping on this, but telehealth really does present certain privacy risks. So it's important to discuss these with your patient, along with the benefits of it as well. And it's common to talk about sensitive and confidential topics during behavioral health appointments. So we need to be discussing some things with our clients, like why and when it's important to have privacy, finding that private location for the session, how to communicate using email, text, or our chat feature on our platform, especially if there might be issues with personal safety. Having a code word is good there too. I'll often tell my clients if they feel unsafe or they feel like they can't speak during a session, I'll say, just tell me you are going to get a cup of coffee or you would really like a cup of coffee. And I'll know that someone else is there or that you don't feel safe and that we can end the session immediately. Before the appointment, ask the patient if they're going to have an interpreter or a caregiver present. And we want to make sure that they're comfortable talking about their behavioral health in front of the other person or their mental health in front of the other person. And we should determine if they need to fill out a release of information for that other person. And then lastly, we want to take extra precautions to protect our patient's privacy. We want to state our name and credentials at the start of every session, confirm our patient's identity at the beginning of each appointment, and ask our patient to verify their personal demographic information. We want to ensure that both you and your patient are in a private area where you can speak openly. You can both kind of scan the room with the camera at the beginning of the video visit, use headphones to avoid confidential information being overheard by others, and lastly, just avoid that public Wi-Fi and always use password protected devices to log on to the telehealth visit. And I think it's important to note that we are in that 90-day window at the time of this recording, and we have until August of 2023 to comply with those HIPAA security and privacy rules. So moving from these video health appointments to audio appointments or in-person appointments is going to be necessary if you are a covered entity.